Good day everyone. We are the group 4 and our topic is breeding and health. Breeding and health plays the important role in raising animals. Breeding helps to multiply our livestock and increase the food and resources. And we should guarantee their health and so that can produce more goods for human consumption.
Breeding, the production of offspring that inherits the gene of its parents. Breeding goals are such that animal diversity should be maintained. Indigenous or native breeds should be preserved and promoted. Breeding activities should take into consideration the following traits: a reasonable productivity level even with low external input, adaptability to local conditions, longevity, temperament, and good health. Breeds that are able to provide good quality traits and products. Ability of animals to give birth with minimal veterinary attention.
The use of artificial insemination techniques are allowed. However, artificial insemination using separated, or otherwise modified sperm is not allowed. Breeding techniques that employ any of activities listed below are not allowed. Embryo transfer, genetic engineering, treatment with reproductive hormones, and semen-sexing.
The use of genetically engineered species or breeds is not allowed. Breeding stock may be brought in from non-organic farms with a yearly maximum of 10% of breeder animals on the farm. Exceptions can be granted with specific time limits in the following cases: unforeseen severe natural or man-made events, considerable expansion of the farm, and establishment of a new type of animal production on the farm, or a new breed is developed. When animals are obtained from farms not complying with this standard, special attention must be paid to the animal health and biosecurity and quarantine measures as part of good animal husbandry practices. These standards governs the use of genetically engineered species or breeds in animal husbandry, likely within the context of agriculture or livestock farming. It allows for the introduction of breeding stock for non-organic farms with the yearly maximum of 10% of the breeder animals on the farm.
Health is a state of physical, mental, and social well-being of unworthy and absence of disease or infirmity. The farm owner shall take biodiversity measures to ensure the health and well-being of the animals through preventative animal husbandry practices such as selection of appropriate breeds or strains of animals. Adoption of good animal husbandry practices appropriate to each species, such as regular exercise and access to pasture and open-air runs, to encourage the natural immunological defense of an animal, to stimulate natural immunity and tolerance to disease, provision to good quality feed, appropriate stocking density, and grazing rotation and pasture management.
Animal healthcare should be supervised by duty licensed veterinarian. The well-being of the animals is superior in the choice in treatment. However, treatment must not be withheld for economic reason. For example, if the treatment jeopardizes the organic certification of the animal. Animal healthcare should be overseen by the licensed veterinarian to ensure the well-being of animals. The priority in choosing treatment in the animal's welfare. Treatment should not be denied due to economic concern such as potential impact or organic certification.
Natural remedies and complementary methods are first priority. However, the use of allopathic systems in which medical doctors and other healthcare professionals such as nurses, pharmacists, and therapists treat symptoms and diseases using drugs, radiation, surgery, or chemotherapy. These are chemical entities used to treat or cure cancers. These agents target critical processes for cell division in rapidly growing cancer cells. Most cancer drugs are derived from natural sources such as plants and bacteria. Others are derived from synthetic or semi-synthetic process. These drugs are allowed when no other justifiable alternatives are available. When preventive measures are not successful, as determined by the attending duly licensed veterinarian.
If an animal became sick or injured, despite preventive measures, the animal shall be treated promptly and adequately. If necessary, in isolation and in suitable housing, producers shall not withhold with such medication where it will result in the unnecessary suffering of the animal.
The period between the last administration of restricted veterans drug to animals under the organic management is twice the legal withdrawal period provided in the medical insect, or in case which is the period not specified 144 hours 6 days, whichever is longer. Meat, egg, and laying hence milk from daily cattle must not be sold as organic during the drugs administration.
In simple terms, antibiotics cannot be used preventively in animals, but vaccination are allowed in certain cases when supervised by a licensed veterinarian. Vaccination are allowed when there is a known or expected diseases issue in the area that can be controlled by other methods, or when vaccination is required by law. Certain substances are not allowed to be used in animals, including steroids, synthetic growth promoters, hormones for growth stimulation or suppressions, and hormones for inducing heat or parturition.
However, such substance may be used in individual animals with reproductive disorder condition as preserved by the attending duly licensed variants. Treatment record of sick animal should be kept clearly identify the animal concerned, including details of the treatment and its duration, as well as genetic name of active ingredients, indication and contraindication, brand name, withdrawal period, branch name, and manufacturing and expiration date of drugs used.
The farm operator shall keep updated and complete records of animals' health programs, including disease monitoring, vaccinations, and the warming program and other biosafety measures. Record and should be easily accessible. The farm shall maintain updated and records of medicine purchase and administrations that should be readily available for verification.
Administration records shall consist of the following: veterinary drug order or VDO, accompanied by veterinarian client-patient relationship or VCPR, type of drugs or medication used, quantity of medicine used, date administered, identification and number of animals treated, withdrawal period, and name of license and license of administering veterinarian on the basis of the records. Proper corrections to production practice should be made in order to minimize the need for the application of allopathic medicine. A maximum of 3 treatments using allopathic medicine is allowed per animal per year.